Different from conventional restorative materials that are really intended to be passive in the mouth, these materials are actually designed to interact with our tooth structure. So bioactive dental materials can be broken down into two main categories: those that are depositing apatite crystals and supporting the remineralization process, and then those that are responsible for pulpal and tissue regeneration. But here we have our tooth. That's probably the only obvious part of this, our Activa bioactive restorative material. Here we have our pulp chamber. These are supposed to be odontoblasts. Hopefully you get the idea. And then we have fluid exchange through the dental tubules, and our adhesive layer that is, again, somewhat permeable because there's no such thing as a perfect adhesive, would be the purple dots. So, and then the ion exchange is the blue dots. So basically you can see that this ion exchange is happening through the bond layer inside of the tooth. And this is our box preparation here. Let's talk about some situations where you might consider using these bioactive materials. So this patient is clenching his teeth. Maybe he's bruxing. You see those masseters working. We certainly see a lot of patients in our office that have some sort of sleep disordered breathing. Maybe they're stressed. They're taking an SSRI or other medication that can cause them to brux. So we're doing a lot of appliance therapy, but also having to factor in our restorative material choice for during the day when patients either don't want to or aren't compliant with their appliances. What about this patient? Looks like they could maybe have a history of drug use. Looks like they're missing a couple of crowns or posterior restorations. Certainly significant caries here, deep decay down to the gingival margin. This patient here that has interproximal decay, they're clearly getting food stuck. This is a failed restoration here, new decay on this premolar adjacent. This is a situation where, you know, maybe they're not a super high caries risk, but this could be a trouble area for them. And then this patient who probably would have really benefited from sealants as an adolescent or a young adult that has decay down in the grooves of their teeth. You know, if you're a restorative dentist, you know, sometimes these can look very simple, and then you open up some of these molars and all of a sudden you have a world of decay on your hands. It's not always as straightforward as it looks. Bioactive restorative materials are indicated in restorative situations traditionally treated with conventional composites or resin-modified glass ionomers. The patented wet bond, modulus, and Ion X polymer matrix technologies make Activa bioactive restorative a superior material to restore dental cavities. And then using a material such as Activa bioactive restorative allows for more conservative tooth preparation in line with the most recent guidelines from the ADA.